As far as the epidemiology summary, cases in Washington continue to be high. And it's important to remember that the data we have is likely to be a substantial undercount, since many individuals who test positive at home are not reported and therefore don't get counted in our systems. However, there do seem to be some signs of a slowing of growth in cases in Western Washington. So there is some hope that we may be at or close to the peak in Western Washington. However, we are also seeing an acceleration in the growth of cases in some parts of Eastern Washington. So overall in our state, the situation will continue to be difficult over the coming weeks. Our genomic sequencing data shows that Omicron accounts for practically all of our new cases. Hospitalizations continue to be high. And as Dr. Shah mentioned, our hospitals and healthcare workers are still working under enormous strain. And even though the proportion of cases hospitalized has fallen dramatically with the Omicron variant, and could we show the next slide, please? So the two gray lines represent when different variants became dominant. So the middle gray line shows when the Delta variant became dominant in the summer, and the gray line on the right in December shows when the Omicron variant became dominant. And you can see that with the advent of the Omicron variant, the proportion of cases hospitalized has fallen dramatically. However, the unprecedented rise in Omicron cases that we have seen has resulted that even with this drop in the proportion of cases hospitalized, the absolute count in hospitalizations has been going up. And we have been seeing elevated hospitalization rates for all age groups compared to last fall, and they continue to be highest for the elderly as they have throughout the pandemic. Next slide, please. So as far as deaths, we're watching death trends very carefully. They had been on a steady decline over the last few months, but in recent weeks, there seems to be a little bit of a leveling off. We're not sure if this is a harbinger of perhaps a rise in deaths, which we sometimes see after a rise in cases and hospitalizations, or if this is just a temporary plateau. And so this is something we'll continue to watch carefully. So what these high case counts and hospitalization counts mean is that it's more important than ever for us to do all we can to support our healthcare workers. And so that means avoiding the emergency department unless it's an emergency. As Dr. Shah mentioned, practice mask wearing and social distancing in public to reduce transmission. And most important, get vaccinated and boosted as soon as possible. We see that among Washingtonians, hospitalization rates are much higher than in unvaccinated populations than in vaccinated populations. And death rates are also much higher in those who are unvaccinated compared to those who are vaccinated. So get vaccinated and boosted as soon as possible, and make sure that your friends and loved ones are also vaccinated and boosted. And this is true for everyone, but especially those children and adults with chronic conditions who are at higher risk for severe disease. So thank you to those Washingtonians who have done their part in getting vaccinated and boosted, and a word of gratitude for our healthcare workers who are working under such stressful conditions to take care of people in our